In a knee replacement surgery, there are 2 to 3 things which the patient and a radiologist should understand, and the doctor should always make an effort to explain the details. The first thing is a concern about infection. There is a risk of approximately 2% to 3% risk of infection for any surgery which is performed. This risk gets escalated in patients who are diabetic or who have a deranged liver or kidney function, or there is some disorder which leads to the lowering of immunity. To prevent infection, we always give antibiotics before and after the procedure. The surgery is done under laminar flow operation theaters, and there is strict isolation which is maintained during the stay of patient in the hospital and afterwards. The second concern is what we call as a deep vein thrombosis and leading to pulmonary embolism. Now, deep vein thrombosis is a formation of clot in the leg veins, which happens because the patients are not able to walk adequately in the initial few days of surgery. To prevent this complication, we put patients on blood thinners, which may be injectable or oral tablets. We put them on mechanical compression devices, and we give them stockings, which acts as a pneumatic garments. 3 things plus we allow or we encourage patients to walk as soon as possible. This averts the risk of deep vein thrombosis. The deep vein thrombosis, in very, very rare situations, these clots can migrate to the lungs, and that situation is called as a pulmonary embolism. Statistically speaking, it's a significant risk. However, the incidence of pulmonary embolism is very, very low. So in Indian population, we don't see cases leading to pulmonary embolism. Most of them have only an asymptomatic deep vein thrombosis. The third thing is sometimes patients have metal allergies. So in cases with metal allergies, there might be some reaction happening between the tissues and the component which we implant. It is very difficult to predict which patient is going to have metal allergy and which will not. So in cases where we find there is a significant allergic history, we offer a new modality, a new implant design, which is called an oxenium. So this oxenium is supposed to be inert to all these metal reactions. So in cases where there is a background history of significant allergies and the patient is young, then there is an option of offering an oxenium knee replacement.